Hello, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about wheezing. Normally when we breathe, it is a very unobtrusive process. We are not aware of breathing and neither is the person sitting near us aware of the fact that we are breathing. But if there is a problem and wheezing starts, then the swee whistling sound that you make makes you uncomfortable and the person sitting opposite also uncomfortable. This wheezing can start because of a cold or a cough. It can start because of exposure to pollutants, cigarette smoke, or it can just start because you are a wheezer or an asthmatic. Now, wheezing usually starts before the age of 5 years. And then again, if it starts in adults, it's after the age of 20 years. It seldom starts between the ages of 5 and 20. The people who get adult onset asthma after 20 years are usually obese or have some other factor like they are exposed to some pollutants all the time. Babies sometimes make a crowing sound when they breathe, and this really scares the parents. They think the child has developed asthma as a newborn. This is not the case. It's a condition called laryngomalacia, which occurs because the tissues of the voice box are soft and not as firm as they should be, so they tend to fall back when the baby is breathing. Asthma runs in families, and these families are prone to allergies and are called wheezing families. What happens is that when they breathe in something which is irritating to the lungs, or if they are exposed to dust, or if they have a cold or a cough, their airways, instead of expanding and coughing out this mucus, constrict and collapse. So it becomes narrowed and the whistling sound emerges. The person cannot breathe, so they cough and they become more and more uncomfortable, and the bystanders become scared. Also, people who have a tendency to wheeze do not breathe correctly. Their breathing technique is faulty. There is a diaphragm, a tissue, a muscle which separates the lungs from the stomach. When we breathe in, the diaphragm should move down and the stomach should move out. When you breathe out, the opposite should happen. In people with a wheezing tendency, the action is exactly opposite. So when they breathe in, their stomach moves in and the diaphragm moves up. The lung does not have much space to expand. So it's a very inefficient breathing technique. And when they breathe out, the opposite happens. So even if there's a little bit of mucus or secretion, it is not coughed out. Sometimes people who never wheezed, when they're old, like over 50, they start developing wheezing and difficulty in breathing. These are not asthmatics. They are either chronic obstructive airways disease or emphysema. They would have exposed their lungs to a lot of pollutants. They may have been working in mines, coal mines or asbestos mines, or else they may be chronic smokers or living next to somebody who smokes all the time. The chronic obstructive airways disease can be dangerous, can lead to heart failure and to death. Asthma is depicted in the movies. The person suddenly wheezes, clutches their chest, unable to breathe, and dies. Now, this is not the case anymore. Lots of treatment, emergency treatment is available, and this treatment can even be kept in the house and given when the person requires it. There are nebulizers, rotahalers, and inhalers. These deliver medicine directly into the lungs so that within seconds the person stops wheezing and is relieved. If you take a tablet or syrup to relieve your wheezing, it has to go into your stomach, get digested, and then get carried in the blood all over the body. It produces side effects along the way and takes a lot of time to act because of the delay in the digestion. If you are a wheezer and you have been asked by your doctor to stay on maintenance therapy and take an inhaler or rotahaler or a nebulization at night or in the morning once a day, please do so. Please listen to your doctor's advice. If you are a wheezer and you want to be healthy and reduce the number of attacks that you get, you should learn some sport like swimming, or you should start running, or you should do martial arts, because in the martial arts, the forced breathing teaches you the correct technique. You should practice yoga because pranayama or the breathing exercises in yoga again increase your lung capacity and teach you to breathe properly. Do not go near smokers. Do not have pollutants like mosquito repellents which vaporize in your house. If these things are there, please leave that area immediately. Take pneumococcal vaccine and flu vaccine to prevent yourselves from getting these attacks, which will worsen your condition. This is Dr. Gita Mathai signing off. If you liked what you heard, please subscribe to my Health Vibes channel and press the bell button. The same content is available in Tamil. Thank you.